Sorry.
Hi there, everybody.
Orange they are. Oh my god. So, too many carrots.
Too many carrots. Pumpkin soup. All right, so Em's still got a little bit of a problem with her heels, and I thought I would take you through our adjustment today because we're working all day today, so we're going to be a bit knackered tonight, just saying. It's an interesting one though. So initially we've been dealing with, and we've done a live once before, with pain at the bottom here. Sorry, babe.
Sorry.
Which is really common for people underneath here, which comes as a result of a tight plantar fascia here. You've heard of plantar fasciitis. And it pulls on the end of the calcaneus, which is your heel bone, creating discomfort underneath here. That's not what's happening with Em. She's getting pain down here. Not directly on the insertion of the Achilles point, which is kind of a bit hard to see. I can't tell whether I'm pointing in the right spot or not because I'm blind at this distance. But actually on the back of the calcaneus heel, a little bit like a puppy dog with a little mouth like Lola has taken a little bit of a bite out of here is where the discomfort is coming from, so just at the back here. So it is slightly different to what we've shown before where we're dealing with plantar fasciitis, which is up and underneath here. Please don't get me wrong, the plantar fascia under here and the calf muscle here, which is made up of two muscles, gastrocnemius and soleus. We've spoken about those two guys before. It's all interrelated, but the major problem that Em's got at the moment is her tight calves. Now, I've got no doubt in my mind that Em's got tight calves because we do a lot of stretching, I have to say, don't we?
Yes, we did.
After our
body
workouts.
Yep.
We did a body pump, it's called, isn't it? So we call it pump
Today.
normally.
Yep.
Today. And there was quite a lot of...
there were some high heel raises.
a lot today, weren't there?
All today.
Yeah. Where you're doing whatever you're doing. So it might be a squat, but then when you're coming up to do, what's it called, an overhead press? Is that what it's called? No.
The squatting. We'll just
What's
squat and
that
then
one?
up onto
What was that? What's that called?
Clean and press.
A clean and press. Em knows these things, I have no idea. I just watch Em and do the same thing. With the clean and press, at the end of the clean and press, they were getting you to go up on your toes as well. So, and high, lifting the bar up like that, what's that called? One of these ones, and I'm getting you to go up on your toes, right? So I know exactly what I'm talking about. Make sure you listen to my advice because I know exactly what I'm talking about. Not when it comes to Les Mills, sorry. But there was a lot of stuff up on your toes, and really, when you think about it, even with our body balance that we did, a lot, downward dogs, yes, they do stretch calves, but a lot of the stretching that we do before or after a class, like body combat and body pump, none of it actually captures your calves. So I'm not surprised with all of the work we did on our calves today that these are actually a bit sore with them today. So calf stretching is really, really important, and I will try to show you how to do a calf stretch, but we're without a step, which means I'm in my clinical practice at the moment, and I'll show you how I stretch or show the kids and adults that I treat how to stretch, but I always say to them, please don't tell Em that I'm standing on my table. So I'm going to give myself away because I'm going to show how to do it. But we will take you through that as well. I know you've seen us do that before, but it's really important to make sure that you stretch both parts of the calf, the gastroc and the soleus, or else you won't get this area sorted out. The thing I love about that particular stretch, apart from the fact that it craps on any of the calf stretches that I've ever done before, is that it actually stretches your plantar fascia as well. These two are linked. They are actually physically linked. The muscles come down. The Achilles tendon is the combination of soleus and gastroc tendons. Comes down, it forms that heel, and then it creates the beginning of that plantar fascia. So it's important to stretch both. All right, now, Em doesn't know this because we've never done this before, but I'm about to put Em through an enormous amount of torture. If we had two lots of cameras, I'd have one on her face up the other end, and one down here showing you what I'm about to do, but we don't because we do. My phone's just not working in this environment, so I'm hoping the internet's okay. We've got different internet now, so I'm hoping you're getting this
we have NBN
loud and clear, and we're not pixelated and moving like a robot, or that you can understand what I'm saying. But we're going to do what we can at this end so that you guys can see what we're going to do, and Em can cry at the other end without you watching. And then at the end, we'll bring her on and see whether her mascara has run. Okay, sound like a good plan? All feel for Em, this is going to be a little bit torturous. All right, so what we first need to do is we need to loosen up those muscles in the calf. We're going to show you a stretch to do, and Em will do this for me.
I will.
Excellent. I'm just making sure. Of course, she's going to have to drink lots of water, so Elise, if you're watching, and Vicky, she's going to have to drink water, because when we do dry needling...
I like my bottle at home.
Oh, did you?
Yeah, yeah.
Is that why you've been drinking from a glass?
Yes.
It's good that she's at least doing something. We're going to actually use needles to help loosen the muscles as well. If you haven't got access to someone who does dry needling, then stretching is really the only other way other than rolling that you can really loosen up a muscle. But this is a fast track way because there is just no way that Em's going to give up on exercise tomorrow. She'll definitely be doing exercise, whether or not her calf is hanging off at the Achilles or not, she would still be exercising. So we get in there with the needles because it's a lot faster. And then we're going to do something at the heel that's not going to be very pleasant. I'm warning you. I love you, but it's going to hurt. And then we're going to do some ultrasound.
I'm laughing now.
Yeah.
Nervous laugh.
You won't during it, or possibly even straight
That's
after.
okay,
But then tomorrow morning when you get up, you'll smile at me. And then we're going to do some ultrasound over the top of it because I'm going to create inflammation with the process of treatment. That does happen sometimes. I'm not a meanie. It just does happen when you're trying to heal something. Sometimes you really have to break down some adhesions, which is what's going on here, so that we can make this as fast a recovery as possible for Em. So let's get started, shall we? I'm just going to move the camera back a touch, I think. Can I trouble you to swing your beautiful legs out of the way here, baby? I'm not going to get you to stand on this because I think it's not going to be great, but can you control the camera just so that we can see what's going on? So I'm going to show you, I want you to imagine a step, preferably a step that you're meant to stand on. This is the end of my table. This is where I show my patients to do it because I don't actually have a step in the clinical room here. And I ask them, shh, don't tell him I'm standing up on my table. So we stand up, we get the ball of our foot on the end of the step, and then we drop the heel down. Now the idea here, this is stretching the top muscle up here, the gastroc, and it is pulling all the way down to the Achilles there where Em's getting her discomfort. So we're pulling, wait for a whole minute for that stretch, and then we've got to force that heel down. Then once you've done a minute in this stretch, you need to, this is leg straight, right, knee straight. You then need to bend the knee, and inadvertently when you bend the knee, the heel wants to pop up. You have to force the heel down, and then you'll feel the stretch pull all the way down here, which is where soleus is. Sorry, it looks like I've scratched my leg. Sorry about me. And that will stretch the lower muscle, the soleus muscle. So then you're getting the stretch with your legs straight. Up here, you'll feel it at the top, and then keep forcing that heel down. As you bend your knee, you'll feel the pull all the way down here to the lower part of that calf. And that is how you stretch that muscle. Really important to do that. And like I said, when you've got your foot hanging
on the step, not your table.
Yeah, not on the table. I do this afterwards. It does stretch underneath the arch as well. So that's also why I love it. Apart from that fact, anything else that you've ever done, like pushing up against a wall, it just doesn't stretch as well. Seriously, that is the best stretch ever. All right, now, onto your tummy for me, beautiful. Flip your pillow out the way. We're going to do some dry needling here. Did you move that camera back for me, beautiful?
Yes.
That's right. We'll just slide it back in there so that you can see the torture unfolding. I love you, baby.
I love you.
There is an element of satisfaction that I get from doing this. Now, of course, when I do this in clinical setting, I wear a glove, but Em's my wife, so we exchange bodily fluids, just in case you were wondering. It's all good. All right, so the needles that we're going to use, probably hard to tell from where you're at, but they're extremely thin. Really, 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 really thin. They are sort of long, but they are thin. Now what I'm feeling for here is the areas of trigger point tightness. So when your muscle has been worked really hard like Em's has, or on a repeated basis being tight, so if you're wearing high heel shoes, for example, or you're in an occupation that requires you to go up and down ladders or something like that, these muscles can hold on to some of that waste product, that lactic acid, and it can create little trigger points. And we feel those with our hands. You can feel where they are. If someone rubs them, you go, oh, yolch, that's where it is. And that's exactly where we put the needles. Right where.
Oh,
nice twitch and a good reaction. Oh, she's even swearing. Oh, there's heaps of love coming for you at the moment, babe. Lots of love hearts happening. Thank you. We do appreciate the love hearts, folks. You're making beautiful comments. I can see them sliding up the page. I normally wear glasses, so I actually can't see what your comments are. I am very sorry about that. I choose not to wear glasses because the ring light that we've got to provide a bit of light here for you to see what we're doing reflects off my glasses, so I'd look weird. I don't want to look weird on camera. Just going to get that on there. Which is the sorest leg on yours, babe?
This one.
Oh, the fun that we're not even in the bad leg at the moment. Em was saying that this one's just a bit achy, babe, rather than the pain around the heel. So the pain around the heel's just happening on the one side, but that tightness and ache in the feet in general is present on both sides. Oh, yes. Hello.
Oh, God.
Hello, tightness.
I didn't really feel that one.
When we put the needles in, apart from the fact we're trying to find these spots of trigger points, we lock them in. So we actually spin and lock the needle, and then we can agitate the needle slightly. Woo, good twitch. My phone's ringing. Somebody's trying to get a hold of me. Probably someone.
They're trying to save me.
Stop torturing your wife, you horrible woman. Right, that's good. I'm happy with that. The gastrocnemius that we spoke about before actually has two heads. So if you've ever travelled along behind a cyclist and you see that really nice, almost love heart shape at the bottom, that's the gastroc. There's two heads to that muscle. It forms one tendon, but it comes in and around here. If Em was to contract her foot, please don't, but if Em was to contract her calf, she's got a beautiful love heart shape on her calves like this. We're actually working on the lateral, the outside head of the gastroc in Em, because that's where the tightness is. Generally speaking, when I see patients, more often than not, it's the outside muscle that's the issue, and it's how we roll our feet or how we walk that causes that distinction as to whether it's on the inside or the outside. Some people have slightly different biomechanics of their feet. Every now and again, we'll get someone who's got a really tight inside calf, but most often than not, it's this outside one. So when you're doing your rolling, you'll probably find that when you sort of lean slightly off to the side and roll the outside of your calf, you'll find that that is more tender. With the rolling, we never roll behind the knee. We only roll up to the point where the popliteal fossa, which is the name of the back of the knee, where it starts, and we can roll right down. We do sometimes roll onto the heel. I often say don't roll on the bone. There's no point to do that. But in this case, the insertion point can often be quite tight. So getting the roller just on that spot can be actually quite relieving as well. But the main thing that we're trying to do is roll the tension out of these muscles. So lactic acid is in there. If you don't have access to someone who does needling, you can stretch, which causes the muscle to become anoxic at the time. There's no oxygen in there, and then all of a sudden you let go and there's a big flush of oxygen again, helps to flush away the lactic acid. With rolling, similar thing, you're rolling on it, your body weight is pressing on that roller as if someone's giving you a nice massage, and it's flushing that lactic acid out of the muscle. It goes into your bloodstream. The same as with the needles, we don't get it out of Em's body. She's got to do that herself after the treatment, which is why she needs to drink water. We get it and we agitate these needles to get the lactic acid out into the lymphatic system. The lymphatic system will then take that back off to the kidneys in the end, and we end up peeing it out. So that's why you've got to drink lots of water. All right. Otherwise, if you don't drink lots of water and you have a massage, or you do rolling, or you have dry needling, you will find that you will get either achy all over, a little bit like a mini flu, if you like, a little bit of delayed onset muscle soreness sets in, or you can end up with a horrible headache. So make sure that you do drink plenty of fluids. We encourage you to drink fluids regardless, but particularly if you're having any sort of body work done to your muscles, because it releases lactic acid. All right, so I'm twisting these needles. What happens with these needles is they lock onto the trigger point, which this one has already, and so we just agitate. It's just a very slight in and out movement that we do, which kind of flushes the lactic acid out of that muscle. How you going there, babe?
I can't feel it.
Excellent.
Feel.
Em was just saying she can't feel it. I don't know how well you can hear her with her face down in the hole there. This process normally takes about 10 minutes, but really, body dictates this. So if the needle starts spinning and the lactic acid is gone, we take the needle out, we're done. If it lasts longer than 10 minutes, then it's obviously a lot of lactic acid and we need to leave it in for a little bit longer. So it just depends on what happens, but generally speaking, 8 to 10 minutes usually is done and dusted. Once we've done this and we've relieved that tension in the muscle, so keep in mind the muscle it's pulling, the gastrocnemius, not the soleus, that's why we can bend the knee and get the soleus and not the gastroc, actually attaches over here to the femur, the big bone of the thigh. And that, as a result of that, when this muscle is pulling here and pulling at this end, or there's lactic acid in here and it's tight, you'll find that it pulls on either insertion point. You can either end up with a sore knee, or you can end up with a sore Achilles or heel, which is what's happening with EMS at the moment. It's pulling at both ends. You've got a muscle that's so long, if it's tight, it's this long, it's pulling on one or two of the ends. It's pulling on both, but you'll feel symptoms usually on one side versus the other. So, have you had any knee pain, babe?
In my left knee, yes.
Left knee, okay. That's interesting. Maybe the tightness from this one's pulling on that bit and the tightness from this one's pulling at the bottom. She's a unique character, my beautiful wife, peeps. Very unique. Now let me allude to what we're going to do after this. Once we've dealt with this muscle issue, we're going to get down to the insertion point and we're going to work on where this Achilles is inserting into the calcaneus. Let me introduce you to this little device. Don't you look. It's very sharp and dangerous. No, I'm just kidding. She's got no idea what I'm talking about. This is going to help me, rather than just using my thumbs. Keep in mind that I treat patients one after the other, so my hands get a little bit sore after a while. This device actually helps me to really work and compress areas, particularly like heel spurs. With a heel spur, the plantar fascia, the insertion of that muscle, which goes under your foot, creates the arch, has pulled away a little bit of the heel bone and it's created a spur on that bone. Now, if that remains, whenever you walk around bare feet, you're basically jabbing yourself with the bone from the inside out and it creates discomfort. So we use this to be able to break down that bone so that the body can then reabsorb it and do what it needs to do. Always we use this with Bone Aid Relief Cream. Really, really good way to be able to help the body to regenerate that bone stronger so that the problem doesn't come back again. But that's what we're going to be doing with this. I always use Bone Aid Relief Cream with KiroFix or Trauma Relief Cream. Same thing, different name, but same thing. Or else you will find that you'll create inflammation and then it'll be super sore later on. So I use both so that we can reduce the inflammation that we're creating. And as I said, once I've done that, I'm going to use the ultrasound because it is going to be quite tender if I don't. Because I'm a good wife.
You're the best.
And Em's got to look after the people at the front desk and deal with our orders and things like that. And I don't want to be in pain. Or she might send people home and then I don't get paid.
And I'm not grumpy when I'm in pain.
She's actually really good. I'm way worse than you. You're really good, even when you're in pain. Sometimes she'll go days and I'll catch her doing one of these numbers. Like, baby, you sore. She's like, yeah, it's been a couple of days. I'm like, hello, you're married to a chiropractor. Yeah. Let me know and I will shoot you.
But a chef doesn't want to cook dinner, right?
Yeah.
So
she doesn't have enough self-love to put herself high enough on the priority list to ask for a treatment. Do I ever go, no, I don't have to treat you again? Do I ever do that?
No.
Okay, just checking she delayed. Did you guys hear that? There was a delay. She went, no, babe. Maybe I do. Do I? Do I seem grumpy and annoyed?
Sometimes I'll say I've got something sore and you're just like, oh, okay, and then that's it.
I've told you and you did nothing about it.
I'm like, okay.
Oh, sometimes there'll be an issue. I say, have you done your stretching and have you drunk water? And she'll be like, no. And then I do walk off, I have to admit. I'm mean. But you're right, there are times when I can't be bothered. Particularly when I've got a migraine. Can't be bothered then. I'm going to get rid of my migraines. I'm done. I've had enough. I'm going to get rid of them. It's going to be a thing of the past this year. 2021. See you later, alligator. How are we going there, babe? Getting a bit tight?
Little. I can only, oh yeah. I was going to say, I can only feel one. I think, yeah.
Oh, and then we've made it two. Has anybody else had pain in that location? It is relatively unique. More often than not, it's either right on the Achilles or underneath the heel, that particular heel pain. But Em's is right around here. It's a little bit different. But, you know, you got to see how she works out. She's pretty full on when she does it. The thing I didn't mention about this morning's workout, the body pump workout, is that Em basically had an entire child on her weight bar. My weights were, minimal, but that's okay. I still got up and I did it. I'm looking over at Em going, wow, she's got like 4 times the amount of weight that I've got. No wonder her feet are sore. Far out.
Every rep counts. Even if it's lightweight.
And when we don't use weights like a pump class, and we do like a body combat class, which is a lot of punching and kicking and elbowing and kneeing and all sorts of stuff just into thin air, Em actually wears weights on her wrists and her feet just to make it a little bit harder because it's not hard enough. I, on the other hand, am just about exhausted. So the only time that I ever do more weights than Em, the only time, is when we're doing body weight stuff because I weigh more than Em does. But then she's probably got an extra weight on her somewhere to counteract that. God forbid I do anything stronger than you, hey babe.
You can
that
do
wouldn't
better
go
than
well.
me. You're more agile.
I'm more agile, there you go. Hasn't been much opportunity for agility lately. No, what do? Obstacle courses and stuff.
Yeah.
Not a chance. These are starting to loosen, so we're nearly done here. Sorry if I'm boring you to tears. A lot of people ask us the difference between acupuncture and dry needling. There is quite a significant difference. Predominantly the difference is the intent. So the intention of acupuncture is to free up the energy flow throughout the body. Chinese medicine, they believe that there are meridian lines throughout your body that are responsible for particular organs and systems within your body. And they find where those energy meridians within the meridian, is blocked, and they use the needles to try and stimulate, or I think they can even tone down excess energy as well throughout those spots. We are specifically finding the location of trigger points within a muscle, and we're putting the needle directly into that trigger point to be able to release lactic acid. Exactly the same needle, that's about as similar as we get. So the rest of it is very, very different. Yes, every now and again, traditional Chinese medicine will go into a trigger point, but likewise we might be in meridian points as well, but the purpose of what we're doing is very, very different, just in case you were wondering. And if you weren't wondering, well, there's a fun fact for you, just saying. All right, baby. I often get asked, do these bleed? Not often. Very occasionally they do. I still like to leave my finger on there to make sure that they don't, because that's gross viewing for people on. I probably should look away if you don't like needles. I forgot. Sorry, peeps. If anybody's fainted and needs help, it's kind of hard to call 000 if you've fainted. But anyway, sorry if I've caused that to happen. But they're so fine. The needles themselves, I'm actually phobic of needles myself, which is kind of ironic, really. But you could fit multiple of these needles inside a regular blood drawing needle or an immunisation needle. So they're really, really fine. They're really, really fine. Oh, there you go, there's a bleeder. See, I put my finger on it, it still bled. Babe, you're bleeding on television.
Damn.
We come prepared earlier. Every now and again we go into a spot where there is a superficial blood vessel just under the surface that we can't see, so that we do get a little bit of a blood reaction. And the other time we get it is people that are on blood thinners. Just collecting Em's DNA. That's really all I was wanting to do this live for.
You're going to clone me.
I am. I want 2 of you. Alright, perfect. Done. Alright, once we're done dry needling, we always use KiroFix. Create a little bit of trauma, heal a bit of trauma. That's my theory. Alright, now part A is done. As I mentioned, we're going to get in to do the stretching and rolling in her own time. I don't think you want to be bored enough to watch that. Now we're going to do some work on this particular heel right here. Yes, it's still in view, so I'm going to move myself so that I can get onto this baby.
Yep.
Do you want to stick to chew on?
Do I what?
Do you want to stick to chew on?
Oh, no, I'm all good.
No, we're good? Okay.
Yep. I'm good.
She says that now. All right, we are applying KiroFix. Need it nice and lubed up, peeps. moving my needles out the way. We are applying Bone Aid Relief Cream. Doesn't matter which one goes first, which one goes second, so long as we've got both of them happening. Right, now, let me get my tool. All right.
You sound evil.
Yeah, it's going to hurt, babe, just saying. Please don't kick me with this one, okay?
Okay.
So we're just going to find the more tender spots here.
Jesus.
She's swearing already.
That's me heavy breathing. Oh, not a...
Sorry, now people can see that I laugh when I treat them.
Ow!
Is it sore on the inside or the outside generally, babe, with the pain?
It's kind of the same.
Okay. The profanities are coming. I hope you can't hear this. What are you willing to endure, baby? We are going to fix this problem.
Yep. It feels really good at the...
Painfully
Before
good.
you get into the heel.
Is it as bad in the middle?
No.
No, good.
Is that because there's more padding? Actually.
No, it's just the way that your fibres are fanning out and what's happening. Okay, that's one side done. I'm just going to
Holy
move my
moly.
chair. You need to breathe
Squeezing
in.
my hands, they may need fixing too.
Em does this thing where she digs her nail into her own hands so that she takes the pain somewhere else.
Ugh.
I'm just like, that causes two lots of trauma. What do you think?
My knuckles like... Oh.
Can I keep going?
Yep.
Right there is a doozy. Sorry, I don't know whether you guys can see it on my head or my hand. They're probably in the way, but rest assured it's torturous. Oh, that is shocking there, babe.
Yeah.
It is crunching. Should bring the camera closer. It is just crunchy. It's horrible. So what's happened here is that M's muscle is pulling so much on the bone, it's creating this like a gristly material in there. If it stays there long enough, it will become bone. It becomes a spur.
Oh, ouch, ouch.
Honestly, sounds like I'm crunching my knuckles. It's really bad. Not as bad up the top there, babe?
No.
Nearly done, baby. It's so good. Well done. Right, now, I'll leave all the cream on there because we're going to do some ultrasound now. This is the pleasant part.
Yeah. Oh, okay.
You did good, babe. Right. Now. Can't wait to get these ultrasounds to you guys.
Sorry.
If you went what?
If I wasn't thirsty before, I am now.
Do you want me to grab you a drink?
No, it's all good. I can wait.
Alrighty. Just going to bring this into my body. It is cold, but no pain. Alright, sorry about the talking in the background. Alright, so we are going to do this for 5 minutes to just increase the blood flow to the area and reduce the inflammation and the pain. The beauty of having the trauma relief cream or the KiroFix as well as the bone aid relief cream on the heel first is it causes the active ingredients of that to penetrate even deeper. Get right down to the source of where we need to and help to start stimulate that healing of that attachment of the tendon to the heel and any of the damage that's happened to the bone at this point. If we leave it go much longer, that gristly part will actually become a heel spur. Slightly uniquely placed heel spur, but it will become a bone. Because over time, if you tug away at the insertion point of a tendon, it will create a strong calcific area that becomes a bone. It basically fills with bone. And then your shoes don't fit properly, or if it's underneath your foot, you start walking on it and it creates more inflammation. You get this self-perpetuating cycle. It's awful. Horrible. When it comes to heel spurs, if they're really bad, we certainly recommend that you don't walk around with bare feet, but we do often recommend a little silicone heel cup that you can wear to prevent it from actually digging into your, shoes or what have you, because even the soft sole of a shoe or inner sole of a shoe can be a bit much for a heel spur when they're at their worst. So this is going to help reduce the inflammation, not only of the problem itself, but also what I just created by doing the work with the little nasty tool that I had there. I'll have to show you what it looks like after this, baby. So mean to you.
It's worth it.
Yeah. Like I said, if we left this much longer, especially with all the amount of working out, Em does a gym workout every day, if not 2. And it would just get a whole lot worse. So these issues need to be dealt with, people. You can't ignore them. You need to actually treat these problems to be able to get resolution and to be able to keep doing what you're doing with your body to keep it nice and physical and healthy. I think Em does her exercise not only for her physicality but also a bit of mental health, yeah, babe?
Yeah. It's like my little time before the household wakes up.
Then she's got to put up with me, laughing when she farts, doing her sit-ups.
Which happens a lot.
Yeah. Decided the setup that we've got at home isn't ideal, because I'm at Em's bum end, and so whenever they get shot at me. I'm like, babe, curry last night, far out, man.
Sorry.
Oh, good. That's why I use the fan. It's got nothing to do with being hot, it's just to blow them in a different direction so I don't have to smell them. It's actually been quite warm, hasn't it, babe? It's nice in the mornings to have the fan. I was actually sweating today. I'm like, whoa.
Yeah, that sweat pouring down my face.
Like, that doesn't normally happen.
No.
I've worked out that's why you wear crop tops. It's got nothing to do with holding up my boobs because I don't have any, but it catches the sweat. I didn't wear one this morning. I'm like, oh, mistake. How's this feeling, babe?
It feels good.
Yeah, this bit's nice and easy. And soon you guys are going to be able to do this from home. We're just finalising our brochure because I felt like there just was not enough clinical information in it to really get the most out of your device. I know a lot of people have been asking when are they available, what's going on, but I have to have that side of things ready so that you really know how to get the most out of it. So good. Alrighty. So, not that you can use an ultrasound at the moment or do dry needling on your own, but I just thought I'd show you what we do clinically to be able to help relieve an issue like this. And yes, you can massage that area of your foot. A lot of people think in certain circumstances, oh, I don't want to touch that area, it's really sore, I might do more damage. In this particular case, it will actually help you to heal a whole lot faster, to break down those little gristly adhesions. Really important. Super, super good. Has anybody got any questions? Because, I'll come and have a look in a minute. I just can't see just at the moment. A lot of names of people that are on there. Hello, everybody. All right. Excellent. Okie dokie. Now I am going to just apply some more of the Bone Aid Relief Cream and Trauma Relief Cream because, as you saw, I just wiped it off. All right. Beautiful. I'm going to get you to roll over for me.
Okay.
Do you want to grab your pillow so that you can rest on your pillow? Just
yes.
Sorry. Not very graceful. It's all good. One of the most confusing things in clinical practice is when people roll over. All of a sudden it went from that side to this side. It gets confusing. Right, I'm just going to shift the camera because...
What was that grainy thing you were using? What was the... I just want to see what the painful tool was.
Doesn't look like much, does it?
It looks
Right.
like a weird wax thing gone wrong.
It does. It's like it didn't
Or if
set
you put that on
properly.
the bench, it's like, who spilled caramel? How could that be so painful?
Yeah, it's because I was pushing it really hard
That's
into
really
your body.
hurty.
I know, baby. I'm sorry. Right, I'm gonna work on your feet now. So
Okay.
I'm gonna. Do you wanna sit up or do you wanna lie down and
Oh,
relax?
I just wonder if I can't be bothered sitting up. I'll just let it.
Okay, but can you slide that way because your little feet have disappeared off the screen.
My bum just went into the divot.
Oh, their bum's in the crack. Right, now, this is the sore foot for the heel, this one here that I'm working on. We're just going to work on the plantar fascia as well because that will be tight because, like I said, everything is linked. So we're going to get in there and we're going to work on this plantar fascia. Oh, yes. There's nothing like a good foot massage. Does anybody else get reflexology done? Cervical spondylosis pain, bursitis nerve compression. Yes, yes, and yes, Alison. Oh, I'm presuming you're asking device as in the ultrasound device. That was a yes to the ultrasound device in answer to that question. Definitely a no for the other device, the caramel. We'll call it the caramel. But yes, yeah, absolutely. Reduces inflammation, absolutely brilliant whenever there's any sort of joint issue or inflammatory response, muscle issue like a tear in a calf or anywhere that has the bone being pulled by a tendon, tennis elbow, shoulder bursitis, trochanteric bursitis, which is in the hip, any of those issues, the ultrasound is gold. Yeah, okay, that was what we were asking. Excellent. How are we coping there, beautiful?
Good, it actually feels good now.
Em really loves a good squeeze of her
I
feet.
do.
One of my New Year's resolutions, peeps, give more love to my wife. I wasn't bad before though, was I?
No.
No. I just feel like she answered that really quickly, so that's an honest answer there, peeps. Yeah, Marie needs one now. I'm sorry, beautiful. I'm coming. They're coming soon. But I really just, it won't do you justice if you don't have it before the proper manual. Feet are really important to keep them supple, peeps. Seriously, consider the footwear that you're wearing. I know that some people choose fashion over practicality or what they do for your feet. I really, really encourage you to pick footwear that's good and supportive for your feet, particularly a nice, strong arch. And I do worry about the size of heels or heels particularly because it alters your biomechanics, but even the sole in general, you know, too large a sole can cause you to roll your ankle too easily if you go over on a tiny pebble on the sidewalk. Do you know what I mean? So we've got to respect our feet because if this isn't right, it then affects your knees, which affects your hip, affects your back, and blah, 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 blah. On it goes, onward and upward. So make sure that you look after your feet. So if you've got a beautiful partner, if you don't find one who's willing to touch your feet, some people are funny about feet. I love my wife's feet. They're beautiful.
Thanks, babe.
You've got to be able to get in there and give them a good squeeze.
Yeah. You can just go down the
favourite
plaza
thing.
to your local.
Yeah, we've got a couple down there.
Oh
Ours
my
is called
god,
Panda
his
in
massive
Brimsey that
big
we
like one of those round turny chairs. I didn't know what to
Yeah.
do. I sat on it and he's like patted the side. I've gone, what? And he just grabbed the whole chair and went
Swiveled the whole thing around. You're like, whoa!
I'm like, thank you. And then I forgot. And then half an hour later it was over because I lay there with my eyes closed. And then he
swiveled
like,
you
swung
up.
it back for
Like,
me.
get off now, lady. It's the next lady's turn.
I loved it. I was going, oh, this is so fancy.
All right, beautiful. We're just going to do a little bit of a check here. Oh no, I've still got my tool with me. Just going to do a little bit of a check of Em's feet. I know that this is a bit rough for you guys at home because you can't do this, but you know, this is like my godsend. This is an activator for those of you who've never seen a chiropractic tool before. Some chiros use their hands. I use a tool to be able to do adjustments. The reason I do that is because with a manual adjustment, you really have to twist the body to beyond normal physiological range. It gives that crunch sound that you've probably heard on television or if you've been to a chiro before. And it means that you've got to stretch all of the ligaments and the muscles into a direction that I personally don't think the body should be going into. So that's my opinion. Other chiros do it very successfully, so I'm not bagging anybody, just saying that's just my opinion. And I don't like having my neck twisted and crunched and ugh. So I'm just going through checking any of the joints that might need to be moved in a particular direction so that we can give Em the mobility on her feet. And I do need to do an ankle adjustment. Excuse me for a moment. Just got to go and grab another tool. This is a portable drop piece table, one of my faves. Slide that in there, beautiful. Come around this way so I don't stick my big bum on the camera. That's better. Excellent. So if we've got everything moving properly, we're going to find that we get a much better and quicker result with what's happening. Okay, baby. This one here just gets achy from time to time, yeah?
Yeah.
So more so than the heel. And he's got all these scratches up her body. Like, we don't do any weird kinky stuff, by the way. That's the dogs scratching.
Yeah.
You got scratches all over you.
Like
They haven't seen her for 5 minutes. Oh yeah, that
But
was
it's
cool
raining
this
here in
morning.
Melbourne this morning, and so
A
we
lot in the
couldn't
last
take
few
them
days.
for a walk. And they were running around the house going, "Oh," and then Stretch ran to the back door, and I'm like, oh, maybe he's thirsty, and he ran out for a big poo.
Like, I normally do this on my walk.
Just realised, oh, there's no walk time. I'll go outside instead.
Okay, so I'm hanging on to it, but oh, no. Clearly she's not budging. We're not going on a walk. Oh, that's your big toe, babe. This could be fun with a slippery hand. Alrighty. That's better. And sometimes people get like sore feet right across here. It's amazing what a little bit of a massage would do to sort that out. Oh, Ella loves a neck crunch, do you? Ha ha! Excellent. You wouldn't like me as your chiro then, Ella. There's no crunching involved here. All right, there's some real tightness in between. There's little tiny muscles. I'm just going to get you to tilt your toes for me, baby. There's bones come through here, 5 bones through here. Then there's lots of little bones in through here to give us the flexibility in our ankle. Then there's one major bone that sits underneath the tibia and fibula here, which is the talus. Often goes out. That's a common one for us to adjust. And then the calcaneus sits underneath at the bottom. That's your heel bone. But these little bones in here, there's little tiny muscles that run in between there, and they can get tight and stiff. So a good shuttle, we call it, with our fingers like that, holding onto a bone at a time and just shearing them side to side from each other. Feels good, doesn't it?
Yeah, it does. Yeah.
It really does make a big difference to those little muscles. Just gives them a little bit of a stretch. You can't get a roller in here or anything like that. We sometimes put needles in here. My daughter often does that. She chooses to wear high heels occasionally when she goes out. And yeah, then she gets pain in through here, and the needles sort it out really quickly. So as much as she hates the needles themselves, actually she's pretty tough. What suburb are you in? Hi Deborah, I'm in Watsonia. We're in Watsonia. Right now I'll take anything. Yes, we are practicing in Watsonia, which is in Victoria, in case you aren't a Victorian person and know the suburbs. It's really grindy up there, babe.
Yeah. It was painful. That was.
So my patients don't wear out my hands. My wife does.
Sorry to anyone coming in after.
Yeah, Em's worn me out.
Sorry.
Do I suggest walking around shoeless? Look, I'm funny with that one.
I'm a germaphobe when it comes to that.
I can't stand the bits
Even
on the
going
floor and
kitchen.
my feet. Oh
my God, if the kids drop food one more time, I stand in it.
Oh, that's gross. No, I totally understand the question. Yes. There's a lot of schools of thought that, we were born without shoes, so therefore we probably should be walking around barefoot. Obviously outside I'm a bit nervous about getting stuck with something in your foot, but I think, to be honest with you, because of the fact that society has us wearing shoes outside, to not wear them then when we're inside, I think it causes too much havoc on our bodies, and then you don't have an arch, and then you do, and then you don't, and then you do. So I really do think that walking around with shoes on is ideal. I know that it goes against what I learnt at school, because they talk about trying to give your body the ability to strengthen the arch and do all those sorts of things yourself. But yeah, I just feel like I see too many people that come in, particularly with heel spur issues. They just cannot walk on like floorboards or anything like that because it's just too painful.
Yeah, and really, when
Way
I put my
too
sneakers
painful.
on, it's like walking on clouds. It's like, oh, love it.
Oh, you're in Mernda, Deborah. That's not far at all. Yes, jump online. The business is called Life Balance Adjustments. If you want to jump online to organise an appointment, you can do that. Just don't come in this afternoon because, I've worn out my hands on it. Oh, yes, we're organising telehealth appointment now. So many people are getting a bit upset about the fact that they can't get to see us. Goodness only knows what's going to happen to borders in Australia, unfortunately.
Yeah. We do want to come to New South Wales and Queensland and
But,
WA and everywhere else.
Yeah, so people are wanting advice without being physically treated, which is all perfectly well. If you haven't heard of what a telehealth appointment is, telehealth appointments are where you can we go through your history together and we work out exactly what the best course of action is. A lot of things you can do at home, a lot of stretching and avoid this, do that, but don't do this, that sort of thing. We can give you that advice at home, and the product that we have online in our online store at Dr Kez Chirolab are exceptional at being able to help eradicate a lot of the conditions that we treat or we go through and show you on these lives as well. So we recommend at that point what products will work for you, and we give you some tips on what to do at home, and therefore you can do it all yourself. Oh, you were asking the same question, Mandy, about shoes. Yeah, I'm funny with it. I really think that we're causing issues with our feet by chopping and changing. You know, I'll wear decent shoes during the week, but on the weekends I'll put on my high heels. It completely changes the biomechanics of your feet. And your feet all of a sudden go, what are you expecting me to do? I just don't understand what you're trying to get me to do. And then you end up with problems. That's so many people that come in after a night out on high heel shoes, and they know they've done it. I'll book an appointment on Monday because I know my feet are going to be stuffed. I'm like, why do you do it?
Because they look good.
Yeah. Well, you know, I'm more function over fashion, but that's okay. All right, beautiful.
But you look hot in a pair of boots, just saying.
Yeah, but not so good in high heels.
No.
It's not sexy if you fall over. It's just not. It really isn't. Awful. All right. Vibram shoes. Like being barefoot. Oh, there you go. Trace, you'll have to check those out. Company name is Life Balance Adjustments. Foot spa last night, put calm oil instead of soul soak. Nice thinking, Ella. Just remember that the soul soak product, the base of the soul soak product, has got over 80 essential elements and minerals. So that makes a big difference to your body on its own, not just the beautiful smell and what it does from a mental capacity, those beautiful essential oils, but the actual soul soak itself. It has Himalayan salt and Dead Sea salt. There's over 80 essential elements and minerals that you do want in your foot spa so that you can be absorbing those to help heal all the bits and pieces going on in your body. When you've got a chronic condition, your body depletes itself of all of these stores because it's desperately using them to try and get you to be back on track. And it just depletes them. You end up lacking in a whole bunch of things. So if you put that in your bath or in your foot spa, you'll replenish those at a much faster rate than eating healthy. Unless, of course, you eat as healthy as Em. And then you've probably got enough in your diet. But then, you know, nobody eats as healthy as Em does. She's just going to go and have another head of broccoli just now. Just so.
Might pop over and grab some fresh tomatoes.
All right.
IGA.
So that's you done. Beautiful.
Thank
Hopefully
you.
you feel a whole lot better. That's my loving act for you this week.
I'll-
So that's it, just one.
I'll cook you dinner tonight. Do you want
Oh.
some broccoli?
Yes. She doesn't actually cook my broccoli. I get it raw.
Raw.
Yeah, because I'm weird.
By request, not because I can't be bothered.
Yeah. No,
I
sorry.
cook mine to like
Slop.
soggy.
Yeah.
Purely because I'm busy doing other stuff. But now I'm so used to it soggy.
Yeah.
I like it soggy.
She does. And she burns it.
It's
Because,
less
not burns
stewing.
the stuff, but the
Less
water
stewing.
runs
I
out.
just put it in my mouth and go, it's all like...
Swallowed. Done. That's how she gets her water, remember,
I'm
people?
probably like killing half the nutrients by...
Yeah, there's no
cooking it.
nutrition. No nutrition at all, just fibre. That's all
But this is stupid, right? I was so lazy, I just couldn't be bothered chopping up my zucchini last night. So I just broke it in half and I threw it in the steamer, and it was so soggy that when I started eating it, it was dripping onto the bench. I'm like, oh, I'm losing all my water.
We've got to do that thing where we test her water. We might do that tonight.
It was so heavy and soggy. Anywho.
All right, folks. I've got to get back to work because my next patient's probably in the waiting room wondering where on earth I am.
That was the 3 o'clock appointment. Just
Thanks for having us on your therapeutic journey.